What are some of the pros and cons of testosterone replacement therapy with utilization of pellets? Dr. Travis Jeffords, Hydro Med Spa. Let's talk about this a little bit. So I do both pellets and injectables. I do pellets for both men and women. The pellet side of the world, what are the pros? Why do my guys choose to go on pellets? Most of the time, the pros from their perspective are more the ease of use, in a sense of getting the procedure done every 3 to 6 months, and then they don't have to worry about it after that. They don't have to worry about the injections on a regular basis. That tends to be the primary benefit or pro that all the guys talk about. Now, the idea of it is it's convenient. That's kind of your biggest pro. The use of bioidentical hormones, that side of the world is a pro some guys talk about. But it tends to be mostly the convenience aspect of it. The con side of the world, it is a little bit more of an invasive procedure. So the procedure can be done rather in the hip or in the flanks, and depending on how much fat you have in that area for us to do the procedure, it may or may not be the most comfortable procedure for you. It could take up 1 to 2 weeks or so, kind of recovery in a sense, soreness at the site, things of that nature. Depending on your dose, it could be upwards of 10, maybe 12 pellets. I've seen, people get placed and people place. It just depends on kind of your thoughts of how to dose and where you're dosing and how frequently you're getting the procedure done. The other issues from a con standpoint are going to be more once the pellets are in, you can't take them out. And so if you overdose, you now 3 to 6 months with this overdose type picture, this really high testosterone. You can add more pellets in, but then it's another procedure. So it's kind of one of those things where if you want control, pellets aren't going to be the greatest thing for you. I can get pretty close, dosing wise, and we'll be within a decent range. However, if you're wanting very tight control, a lot of times pellets aren't going to work for you.